Good evening. My name is Dr. Nitin Narvekar and I am an endoscopic surgeon and an infertility specialist. I am attached to some of the bigger hospitals and I am on the panel at the Breach Candy Hospital, the HN Reliance Hospital and Bhatia Hospital. I have been doing endoscopic surgery mainly related to infertility for the last 20 years. The question that I would like to discuss today is the role of hysteroscopy and laparoscopy in gynecological practice. Gynecological endoscopy involves both laparoscopy and hysteroscopy. Laparoscopy is putting in a telescope through the navel to visualize the entire abdomen, and in the case of the gynecologist, specifically the uterus, tubes, ovaries and the pelvis. Hysteroscopy looks at the interior of the uterus to make sure that the endometrial cavity is normal. Gynecological endoscopy involves both hysteroscopy and laparoscopy, and its use has increased in the last 40 years. It has become an integral part of gynecology, and today most gynecological procedures are carried out through the endoscope. In the 1970s, we had the laparoscopy, which was done mainly for the diagnosis of infertility, and there was no possibility of any treatment through the laparoscope. At the same time, laparoscope was also used for permanent family planning, that is sterilization of the tubes. Today, in the last 10 years, the role of laparoscopy in the treatment of infertility has reduced considerably. This is because of the availability of IVF and more advanced procedures which have a good pregnancy rates. However, what happens is that a lot of patients who would have conceived with simpler treatments are now put in for IVF with higher costs and no guarantee of success. Therefore, complete evaluation of the infertile patient is important before putting the patient up for IVF. Over time, the laparoscopic endoscopic skills have been refined. In the 1990s, procedures like treatment of ectopic pregnancy, treatment of endometriosis, removal of cysts was carried out routinely. Patients who had excessive bleeding were made to undergo a procedure known as TCRE or transcervical resection of endometrium, which involves removing of the entire lining of the uterus. In the 90s, hysteroscopy was used mainly to treat birth defects in the women. Also, older women who had problems with excessive bleeding were treated with a procedure called transcervical resection of endometrium or TCRE, where the entire lining of the uterus was removed. However, all patients with excessive bleeding were put in for this procedure with high failure rates. Today, this procedure is only carried out in a select number of patients with excessive bleeding. Another procedure which was commonly done in the 90s was ovarian drilling. This was done for all patients with polycystic ovaries, and today we realize that it is associated with a lot of problems like destruction of the ovary, early menopause and development of adhesions. The scope of laparoscopy has increased tremendously with all procedures like hysterectomy, removal of fibroids, cyst, treatment of advanced endometriosis can be carried out through the laparoscope. More accomplished endoscopists are able to treat certain gynecological malignancies through the endoscope. However, it is important to understand the place of endoscopy in gynecological problems. It should not happen that simpler procedures which can be done by older methods have to be done laparoscopically, and for this both the patient and the doctor should not be dogmatic about using endoscopic surgery. It should not happen that because you have a hammer, every problem is a nail. Choice of treatment for the patient, which is best for the patient's well-being, should be employed. In conclusion, endoscopy has a very prominent place to play in gynecological problems. However, it is extremely important to choose the right procedure and for the right patient. Every endoscopic surgeon should know his limitations and choose what is best for the patient. If there are any questions regarding this problem, you can contact me through librate.com. Thank you.